So board stuff today. Board stuff's kind of a little all over. We are going to eventually, after midterms, start getting into animal behavior, body language, animal handling and restraint, and then that'll lead us into our physical exam, which we'll get to with anatomy too. So this kind of gets us sort of kind of used to that, or in that frame of thinking with physical exam. So maybe not all of it pertains to the week, but we'll get there. Yes.
We're gonna go over this week's homework since it's another essay.
It's next week.
That's, yeah, next week. We can, but yes, that is next week's. So yes, eventually. All right, so a couple abbreviations to start with. I think we've talked about this one before. Have you seen TPR? Very good, that's exactly it. So this is what we consider our vital signs. Okay, blood pressure is not included in one of our big vital signs for our animals, unless we have reason to believe they need it. So the other two things that kind of go in with our vitals are included in our TPR, but they are our mucous membrane, color, and then our CRT. I don't know, have we talked CRT before? Okay, cool. So these are just, again, a couple of the things that in really less than a minute, I should be able to gather all of this data. Okay, so with my temperature, obviously you're taking the temperature of the animal. We generally do this rectally. Some clinics have the oral thermometers. They're not found to be as accurate or reliable as using a rectal thermometer. So that's how you get your temp. Pulse, this is kind of a weird thing because you learned in cardiac that pulse and auscultation is not the same thing. Generally, when people get a pulse, what are they getting? An auscultation count. But again, the way I teach you guys will be you're listening and feeling at the same time, and that should always match. So pulse is your auscultation and then palpating the pulse. Generally with pulse and respirations, you're counting for a certain amount of time and then timesing it by a certain factor to get to minutes, right? So we'll talk more about that. We have BPM, which can be two things. So beats per minute and then breaths per minute. Okay, and this is again how we are getting both our pulse and respirations, is how many in a minute. Okay, so generally I will count for 15 seconds and then times that number by 4. Okay, I do it a little bit differently with the heart. I will actually auscultate for 15 and then start counting for 10, and then I can just do really simple math, 10 times, or whatever my number is, times 6. Really, I don't care how you do your count, so long as it is accurate within a minute. And we double check you, of course, when we start doing this. And then what's a PE?
Physical exam.
The physical exam. Okay, so again, when you start bringing you guys as animals in, that little line on the med record form of chief complaints, it means why is that animal here? Everybody in the world can write PE because everybody in the world will get a PE. Okay, cool. And then what is a sculpt? Listening. And what is palpate? Feeling or touch or cool. And then your otoscope, what is it going to look in?
Ears.
It is an ear. Ear scope. Viewer thingy.
Does yours have the side thing where, like, if you're looking in the ear, one of us can look through the side thing to see what you're looking at?
No, but I did actually just order a video otoscope that hooks up to our projector. I just ordered it. So it'll probably be a couple weeks before it gets here, but that is something, ophthalmoscope, geez, that is something that's been a real struggle forever, is teaching students how to visualize the eardrum. Because like I will get it in and show you and then have you take over the handle and look, and generally when you take it over, you've moved.
Right.
So yeah, we just ordered this video otoscope, which is Super nice. Been wanting to get it for a while, just haven't had the budget money. The ophthalmoscope, OPHTH, that still doesn't look right.
It's just OPTH, isn't it?
No, it's OPHTH.
It's OPHTHALMOSCOPE. Oh, that thing.
Ophthalmoscope.
I was gonna say, something's wrong with that. That's how I had to remember is OPHTH, because I always misspell it, OPHTH. Okay, and then PLR, this is another thing we do in a physical exam.
Papillary light reflex?
So close, yes, pupillary light reflex. Some people say response, it's a reflex. That's why we're checking it, is to check nervous system reflexes. So this is where like you shine the light in the eye, the pupil should constrict. When we do PLRs, we do what's called direct and then consensual. So what should happen is when you shine the light in one eye, this pupil constricts, but so does this one. The eyes should work together. Yep. Yep. And then the same thing, in the absence of light, the eye will dilate, the other eye should as well. So direct is the eye that you're pointing at, consensual is the other eye. Okay, you guys will see that when we start with PEs. All right, you should remember drugs used in euthanasia are barbs. Are barbs. And yes, they can have 1,000 different names, trade names. Euthazole and Fatal Plus are the two big ones I have used, but there's 1,000 different ones. And that's what's actually gonna kill them, right? But there's other drugs that we use often as well. Sedative, sure. And this can be anything under the sun. So this could be acepromazine and butorphanol. This could be dexmedetomidine and tor. There could be dex and ace. It could just be ace. It kind of depends what is the doctor's protocol, what do they like using, and then what, how's the dog reacting? Is he super nervous? Is he anxious? Is he practically already dead? Right? The number one form used in euthanasia.
IV.
Wait, for what?
Oh, a form. A
Form.
form.
Forms?
And I wasn't thinking paper, like method.
Oh.
Yeah.
I would have probably said technique
Oh.
or method. Forms, yes, paperwork. The number one, they must sign consent. It must be in writing. Because why?
Can't reverse it.
Yeah.
So that it is a legal binding contract between the owner and the vet. And so that they can't say 2 weeks from euthanasia, you killed my dog and I didn't say you could. Right? This cannot be a phone call conversation. It has to be in writing. Okay? Has to be in writing. All right, and then our normals. We're going to start learning normals. And this is something you must have memorized. Okay? There's no ifs, ands, or buts with these. So normal dog heart rate, anybody know?
80 to 120.
We're going to say 60 to 160. And this is a big range. Small dog, big dog. You can find this on page 214 in your Bible, if you'd be ever so inclined. And then our cats,
140,
220. Very good stuff. Close enough.
Why is there such a giraffe?
This is a calm cat chilling on the couch, chilling.
Okay.
This is him plus some when he
Pissed
comes to
off.
the vet's office.
Okay.
Okay. And then again, this is going to be more large dog, right? So maybe like 60 to 90, 60 to 100 for your giant ass dog. Whereas your smaller dogs are going to have your higher heart rate.
Oh.
So if a little dog had a 60 per minute, that's
We'd be
definitely
worried.
bad.
Exactly.
Okay.
Exactly. But again, as far as the range goes, this is your broad range for these two species.
Is there somewhere that like shows you the size of the dog, what it should be?
No, that's where this comes in, and I'm hooking you up by telling you large dog size, small dog range. So again, large dog normals, I'd probably say 60 to 100. Small dog normals would be more on the 100 to 160. But again, we're doing a broad range to cover all of those breeds within this species. Cats are generally just cats. That's just a decent range. I've had cats clock closer to almost 3 because they're so nervous, anxious, worked up, scared, painful. So this is just a good baseline, okay? Just a good baseline to start. What I'd be interested to have you guys maybe try, if you thought you might also be interested. You've all sculpted now. You've all tried to pulse palpate. Start counting, right? Do it in 15 seconds. How many times did you feel a little pulse in 15 seconds? And start kind of practicing the idea of listening, counting the beats, or feeling and counting the pulses. And or what's even easier is just watch your animal breathe, right? Every time they breathe, count, right? And try to just practice this, right? Okay, cool. So that is our basic board stuff, kind of just general board stuff. Like I said, we start getting into a lot more animal behavior, handling, body language, all of that kind of stuff, which we have to cover before we get to physical exams, but they are coming. They are coming, in fact.
Is there anywhere that has normals for like smaller animals like rabbits, guinea pigs, and stuff?
That would be in your exotics book
Okay.
that you'll get next semester. Yeah. Yeah, that doesn't really have as much as I thought it did. Okay, so we're going to pull up just the procedural form for euthanasia. We're just going to kind of go over this. Some of you guys, maybe wonder, why do we just watch a whole bunch of dying animal videos in class? A big part of it is so many of you guys have never seen this before, right? Again, it's a little easier to kind of go over some of this in a comfortable environment, right? Where we can maybe, ask questions, sneeze, maybe giggle when that would never be appropriate in real life, right? So this is gonna be weird, I'm not gonna lie. Videos aren't fun. But for those of you guys that haven't seen it, this will make hopefully the real life version when it happens to you a little easier to accept and get through. Yeah.
This is more of a personal question, but is it just like the first time you see euthanasia, or does it get better over time? Like, did you personally have a hard time handling it?
For every person.
Yeah, I agree. It's different for every person.
I feel like
think
it
just like
depends.
anything though, the more familiar with it you become, the less scary it is. Every euthanasia is different though, and so much of my reaction has to do with how the clients react.
That's big.
In the Bay Area, we had a lot of gay couples. I can't even with them. I can't even because they bawl and I bawl. If you have, somebody who's pretty resolute in the decision, not really affected too much, it's my job, I'm doing my job, I'm probably not gonna cry. Again, I don't look at euthanasia as a sad thing. I look at it as a helpful thing. I have the power to give this gift. And again, reducing suffering, ending suffering. It sounds like so many of you guys' stories had some little bit of suffering maybe too. We don't want our patients to go through that. That's why we do this. Even at the shelter, I had to look at it as this is my job. This is a community health thing, and I'm doing my part.
No, it does.
It's different for everybody. I think how your clinic culture has a lot to do with it too. Because if you have a whole bunch of people, or even just one person, it takes just one, right? Bad apple. If you have one person who's just not the emotional type, kind of a dick, I don't know. I mean, guys, man, I could tell you stories. it makes it harder to do it when you have people who don't maybe empathize the same way that you do with your clients. One thing I'll say before we even get started here, because we didn't really cover it, a little bit of it's on this that we'll cover here in a minute, but okay, we do the paperwork, the client pays, we euthanize the dog, the client has left. Now what do I do?
Go to the next patient.
You go get a black trash bag and you put the dead body in the bag. That's your job.
It's part of it.
That is exactly what happens after the dog dies. You bag him, okay? Unless the owner's taking the body home, in which case you prep it in a casket or whatever. I'm sorry? Yeah, no, that's why I said black trash bag. So you bag them. I worked with people who treat the dead body like a dead body. I don't. I just treat him as if he's still alive. I gently place him. I mean, I've seen people who bag the body, whip it up, spin it around, tape it up, sling it.
What?
I'll fuck you up.
God. That's horrible.
Again, but it's a dead body to them. They don't feel that empathy the same way. So that does make it hard, right? I will expect you guys.
Mother?
Exactly.
God.
You bag him and you touch that dead body like the client is watching you. All the way out to the freezer, all the way out to the crematorium or whatever. You are pretending that somebody is watching you. And what would they think of how you're treating their dead body? So I do expect, when you're bagging, you're doing it gently. You are not sinking it up and spinning it around, okay? That's not how we do. That I think is maybe the hardest part for people. They can get through the process, they can get through the death, but now you're confronted with a dead body, and if you've not dealt with one before, there's a little bit of levity to that. It's heavy and you need to get through it right away and make up your mind on how you're going to handle it. It makes you face your own mortality, I think, as well. But then it also makes you, again, more resolute to treat every living patient with even more respect, right? Okay. It's gonna be deep, guys. Your first time is the hardest because you've just never done anything this before. It gets easier. I mean, it is just part of the job. I hate to generalize it like that, but
What do you do?
I mean, that's part of the job. So yeah, I mean, you see somebody treating a dead body like that, speak up and say something. How would you like it if that's how so-and-so treated your dead pet, right? Some people, I think, they've been doing it 30 years. It doesn't matter to them anymore. They're so callous. Don't get that way, guys, right? All right, so I'm gonna pull up the euthanasia procedure that comes from, I think it's the Mosby's Comprehensive Review book. It is one of your recommended titles. It's more of a Whitney prep, but they have a lot of really cool appendixes, so that's kind of what this is. And you can access this on Blackboard and print it out if you're so inclined. We'll just kind of go through a couple of these steps. Okay, so some of this we've talked about. We did a little bit last week when we covered the euthanasia chapter. So again, when are we doing the euthanasia? What do we say is usually the best?
End of the day.
Yeah, end of the day, or when there's really no other appointments on the books, just so that that client can have nice, quiet, dedicated space. Who's going to be there, right? Who's going to actually be present? Is nobody going to be present? That changes things a lot. How will the body be disposed of? Again, you don't want to have this conversation after the fact. You want this to be well known before you actually do the procedure. Again, after the animal's dead, the client's not in the right mind to make decisions or may not understand completely the decisions that they're making. So this is where, again, you pull on your silk gloves and say, Mrs. Smith, after Frankie's passed, what would you like to do with his remains? Right, and then you can give options, right? Do you want to take him home? We can provide you with a casket. Don't worry, we'll make him look beautiful, right? Or you can give cremation options and make sure that they understand what that means, right? And then again, you're making them pay for all of this up front, right? Will a necropsy be performed? Dr. P will offer to do free necropsies on some of her patients, especially when she does not know 100% what caused the death. When I worked at Babs, I was really, really lucky because it was considered a teaching hospital that we had on our euthanasia consent form a little box. Do you authorize necropsy or not for teaching purposes? So many different procedures I learned for my first time on necropsies, like placing a vaginal catheter. That's really hard to do. The first one I've ever done was on a freshly dead animal, and it helped me quite a bit. Placing jug caths on a recently dead animal. Again, it's one of those like ethics things, because we didn't say we were going to be practicing, but we can consider it part of the postmortem. Did that let me go? Right? This is something some owners can't take the thought of. Myself, even with Jim Bone, Dr. Adair had offered to do a necropsy on him, just to open him up and see if there's anything obvious. And I couldn't even. And I freaking love necropsies. But I couldn't even bear the thought of Jimmy being cut open and gone through that way. Hopefully when you guys get your necropsy, it'll be a good one. Because sometimes you can't necessarily see the disease process from the outside as well as you can from the inside. Dr. P's had a couple that have been really good, like really good. And then sometimes they're boring. You can't tell anything. You're just looking at organs that look fine and you don't know.
How do you suggest we prepare for that? Because I'm like not looking forward to that at all.
This is the one part.
It's
I'm
really
just
not. I don't think it's that
prepared for
bad.
yet.
I don't know, like a dissection.
Yeah. Did you do a cadaver lab at all?
No. All I've ever did was like a fetal pig or a cow eye or whatever.
You didn't have to do anything then?
No, I never did.
So I will say you won't be the first person to cry if you cry. I'll tell you this again. It's not like, it's not like you're just going and getting an animal and just cutting him open. I mean, he died for a reason. It is our job, your job, to figure out the reason. Take it as a mission. Will you have some emotion? It's okay if you do. You will not be laughed at, judged, pointed at, or anything if you happen to cry a little bit during the lab. Again, this is going to be your first time, and a lot of people's first times, right? And seeing a dead animal and then working through its organs. I think you can maybe pull out your appreciation of science and anatomy. And I'm looking at Haley, but I'm talking to all of you guys, and look at it in that perspective. Without this pup that died for us, we wouldn't learn, right? So again, thank you, pup. And you will see, I talk to dead bodies, guys. As I'm bagging, I say, it's okay, Bubba. It's okay. Let's get you in here. Go ahead and do this, okay? God damn, just talking about it, right?
I know, I'm already like,
because it is. You take it that freaking serious. If you were upset a little bit, I'd be worried that you're callous. Maybe you don't have a heart. Dark soul. Black witch.
Look it up, you have to find it.
I thought I was, but I'm clearly
No,
not.
honey, it's okay. You're not the only one. It's going to be hard, but again, you're going to be able to look at it and say, thank you, Kat. Thank you. Right? Because without you, I wouldn't know what the inside of a long lobe looks like. Because will you? When's the next time you're going to look inside a long lobe? Never, right? So this is one and only time, a 4-hour lab. We'll get through it. You'll learn a ton from it. You'll appreciate the offering that was given, and you'll move on. And that's for all of you guys, right? Just like with the euthanasia, I mean, your first time's gonna be hard. You're gonna have to have that soul search in your own heart on how do you feel about this, okay? And that goes for everybody, right? Remember we said way back day one, it's a gray zone. Sometimes you can't be on one side or the other, but you can kind of determine how you feel. And your feelings are going to change over time, for sure. Yeah.
Are we ever, I mean, it kind of sounds weird to put it this way. Are we ever going to really have, not necessarily a euthanasia lab, but are we ever going to experience it in school so that
Likely
people can
during your
prepare for it?
externship. But no, we do not and cannot euthanize.
Right. I didn't think so, but I just wondered maybe.
Yeah,
prepare
I mean,
people for
if
it.
there was an event, you know, it would probably be an anesthetic event. We would handle it then, but I do not have euthanasia drugs. I do not have the capability to get those. So yeah, I'm gonna say no. But during your practicum or clinicals, you do have that as one of your lines. In fact, I think there's 3 lines to participate, which means that you can just stand in the room and watch. There's another line for actually perform. Your veterinarian, as a student, will let you, and a lot of them will. In fact, prep yourself. We can talk more. Again, a veterinarian's job is one of his 4 things to euthanize animals? No. So a lot of the time, he's got better things to do. We'll talk. Just because I know that's a tech job there a lot of times, especially for non-owner present ones. But yeah, the 3rd line I think is to participate in the aftercare. So bagging, getting the cremation paperwork together, whatever. So when it comes down to that, do you have to do all 3? No, but you have to have a completion of 75% of the entire form. So if you can't do XYZ procedure, you might need to work on that. That's far out for you guys in terms of your practicums. But yeah, you know, if you're in clinic now, chances are you've seen, witnessed, or at least heard, right, some of that. Whether or not you're the one actually doing the injection, you know what you need to know. Okay, the only thing that would be different is you actually pushing it, I guess. What's that?
I pushed it on the camera.
That's crazy. That's craziness. And then again, payment. The client, is the client able to drive? If she's a freaking wreck, you are not letting her walk out the door, right? You take her back to the client break room or back to the cry room or something until she's okay to get home. Or can I call your husband for you? Or something, right? I mean, we do, again, I'm sorry?
Husband better be there.
Well, yeah, I mean,
Whoa.
you never know, but it's one of those things, you know how you would feel leaving the clinic, bawling, crying, getting yourself in a car wreck. We don't need that, do we, right? So just some things to keep in mind. Again, once those decisions have been made, then we can actually get on to the procedure. We've talked about step 1 already. This part I think is very important, making sure that the owner can tell that we care. Okay, and this I think goes beyond just the euthanasia. Anytime I do a physical exam in front of a client, I'm going to, again, treat them like I'm being watched, right? Or like I'm working on my own animal. With euthanasia in particular, comfort levels can be having that extra blanket, right? Yes, I know you're dying. You've got 3 minutes until you're seeing Jesus, but you can have every comforter I've got in my closet.
Yep.
Right? Because again, we want the owner to really see, we know this is hard. We know this is painful for you. We know that your animal really needs to be comforted. Get some extra blankets, right? All right. Again, with when the animal passes, and this is something owners sometimes know, sometimes don't, that when they pass, they're gonna pee and poop, okay? So a lot of the times when we prep the animals on the table, what we'll do is take the nice blanket that mom brought from home, lay it down on the table, and put a pee pad, and then lay the animal on the pee pad. And then you can take another blanket and cover him up so he's just tucked in and cozy, right? And then when the animal does pee and poop, the owner doesn't see it, right? Because the blanket's covering it, but it's also not ruining the under blanket because you've got pee pads, right? Again, little things that, what does it matter? It's just a dying dog. But these are very small, tiny things that make a difference for how the client views the whole thing, right? This is not a prison execution, right? Okay. So again, determine, does the animal need to be sedated? This is a thing that depends on the disease process, or whatever, usually a disease process is the reason. If they are pretty alert, pretty anxious, panting a lot, nervous, we're gonna sedate them, okay? And again, you can tell the client, we're just gonna give Fluffy something, just a tiny little shot. He's not even barely gonna feel it. It's just gonna take the edge off. Okay, this is not him being euthanized. This is just a sedative to take the edge off, okay? And a lot of times once the animal calms down, the client's gonna calm down too and be a little bit maybe more okay with the whole thing, right? Again, whether or not to place a catheter, this is pretty much a standard nowadays. Not everywhere, but it is best practice to go ahead and place that catheter. Why did we say last week?
So you're not fumbling for the vein.
Yeah, so you're not messing around, getting outside the vein, jacking up like the basset hound I told you guys about, right? Again, catheters are super cheap too. Some owners though, they don't want anything extra. They don't want that catheter. They don't care if it helps you or not, especially in maybe money cases, right? If you don't include the catheter in your charge, that can be something that they don't want to do. And that's why I think it's best to just include it as your standard. If you do place a catheter, you will place that catheter and take the animal back to the room or leave the room so that the owner can have a little bit more time. And this is when we say, Mrs. Smith, when you're ready, you knock on the door, I'll be waiting outside. Okay, because I don't care if this euthanasia is scheduled at 4:30. If it takes till 5:15 till you're ready, I'm gonna sit outside this door and wait. You guys all know when you're scheduled till 5, that means you don't get off at 5, right? Okay.
Add an hour.
Mercy.
Add an hour to it. That's when you really go.
Minimum, right? Because again, with stuff like this, are we pushing the clock? Come on, Mrs. Smith, we close at 5. Of course not, of course not. We're gonna let her have as much time knowing that this is the last few minutes she has, right? Yeah, if you do place a catheter, make sure it's patent, that's all that one says. Again, kind of going through the process with the owner is something that has to be done either by you or the vet, as far as when I inject this solution, it's gonna make his organs stop one by one. He'll take that last final breath and his heart will stop beating. At that point, we know that he's gone, right? And it's very important that when the vet does this or when you do this, that you actually make some attempt at either listening or feeling or something and telling the owner, he's gone. He's passed. It's over. Okay, you have to give some kind of finality to that. Or the client might go home thinking, did he die? Did he really die? Are you sure he's dead? Are you sure he didn't have a heartbeat? You have to give that finality, okay? Again, telling the client as much as you can ahead of time, really helps. After the client, or after the patient rather has passed, again, a skull listen, give some kind of final, message. Ask the owner if they'd like to spend any more time with him. A lot of times the owner will, right, just to say a last little goodbye without us in there. And then we'll generally tell the client, when you're ready, go ahead and step out and I'll step right back in, so Fluffy's never alone. Even though he's dead, does it matter if he's alone or not? Yes, it does to that client, right? And then you'll go in and again, maybe remove the catheter, bandage, tape, whatever. If the owner is taking the animal home, you make them look perfect. If that means that you need to go get the grooming brush and the little spray and do a little quick grooming job, go do it, right? If the animal is just going to be cremated or disposed of otherwise, again, you're treating it, you're not just ripping the tape off, you're treating it like he is alive and that it would still hurt when you rip the tape off, right? Again, when you bag him, you're doing it very gently. I cannot stop myself from talking to my patients who have died. I just can't. And that's, I think, a good thing. I don't know, it gets me through. And then again, if the client needs it, let them know, Mrs. Smith, I'm really sorry about this. If you need anything, you know we're here for you. right? Okay, so really important that you make sure the client understands, like, this is not just a gimmick to get 50 bucks. Like, this matters. This affected me as much as it did you. Don't tell your client that, though, because it's kind of addicting to say, right? Because you can't possibly know. I mean, you do, but you don't, right? Down here, just a couple different websites, resources. This is something, you know, you could use yourself as a clinician and or support for your clients, right? And or if you have, you know, a really particularly upset client, you could have, you know, a little sticky note with a couple websites, you know, or a hotline or something. If you need somebody to talk to and you don't want to call us, here's some resources. Again, you kind of have to use your best judgment with some clients. Some clients want that kind of stuff. Some clients walk out the door and are done, right? So you do kind of have to judge, you know, how are your clients doing? Are they going to be okay? Does she call back in a week, you know, still upset? You're going to put on your counselor card or your counselor hat, right? And talk with her through it. Do the best you can. Sometimes, guys, all it is just listening. That's all they need. Just somebody to listen to them, right? Yeah, Jess.
Okay, so I think a little too personal, but would clinics, like, if they had to use euthanasia, like, call that patient on the road or something, like, how are you doing? Are you okay?
Some clinics rather will, especially again if it's that 30-year client and that dog came from you from a pup to 15 years. You might put them on your follow-up list and just say, hey, Mrs. Smith, just been thinking about you. How are you doing? How long does that take you? And that might guarantee you 20 more years of her service coming back to you because you took 20 seconds to call her and say, right?
The sympathy cards.
Yeah, and the sympathy cards. You know, one thing we didn't cover, I think maybe we talked about it a little bit last week, maybe not.
We did.
At this point, before I bag, I'm making paw prints, nose prints, whatever they want. Some places will do the whole clay paw print. That's awesome. Not every client or every clinic will. There's a cost associated with that. I love just like blank 3x5 cards and bingo markers, like bingo daughters. And I like doing the nose and paws. Sometimes in like a really long-haired cat or a long-haired dog, I'll take a lock of hair and tie it with a ribbon and then cut it off and send that in the card too. There's really no reason you shouldn't do something like that. Have you guys seen Addie's footprint we have in the classroom, our bearded dragon? So she passed away, shit, was that over Christmas?
No.
Was it before? It was during a holiday, wasn't it? Yeah, maybe it was. So Addie passed away. She was our last school pet, bearded dragon. And they even made her freaking paw prints. I couldn't even. Of course, she doesn't have paws, but you know what I mean. They're hanging in the classroom. But that's something, that's a memento, right? That's something physical that they can have as a reminder of their pet. So I don't think that there's any reason not to do something like that. So yeah, whoever said something that reminded me about that, thank you. I'm glad. So that's kind of the basics. Any other questions? Okay, so we'll break. I'll give you 15. We'll come back and we'll watch some vids. Somebody want to stash up on some tissues from the bathroom?
I will stack up in
Okay.
some tissues.
Yeah.
I mean, I have like
All in.
4 left in my frozen pack that might get us through. But we will watch a couple of videos. Again, the idea is not to get everybody sad and depressed and like hating life and make you question why you chose this field, but rather to make you more comfortable with the idea of you being the one to give this gift, right? All right, 15 minutes, meet you back.
And then there was one that they got. There was this
Haley, I love your heart.
big Labrador, and his best friend was a little Maltese.
6 weeks of this crap.
And we were euthanizing the big Labrador because, of course, they get lumps and tumors and stuff. And I remember the dog kind of looking like you know, like, get up, you know, what are you doing? And that's, I think that's the worst I've ever
So
saw.
I'll be like, come home.
But other than that, They're really not as bad as they're made out
It's
to be.
on chapter 8, multiple choice.
Okay.
So then I sort of just assumed chapter
I
9
mean,
multiple choice.
He had been in periodically and he was
I
pretty
know.
asking. Like, kind of
Just
better.
repeat it. Okay.
And
I
then
think,
towards the end, he wouldn't. He would let me
I don't
like sit
think I
there and
graded
cut in and do
so it
all
should
that.
be fine,
And that's how I
just-
knew.
Oh, I did.
Well, and really, like she
Yeah.
said, they're not like. I mean, there's those rare that are like out of the blue.
I know.
Most of the time, it's
I
like
know, I didn't
Jeez.
know chapter 9
you know it's gonna happen.
It's okay. Sorry, that was so harsh.
No, that's
There's this one
okay.
person that cut in off the street though, and they wanted to euthanize her cat because she was too fat. And that made me sad.
So there's like some of those where it's like, oh,
And
we're
she
doing
was
this.
really cute. And I was like, we'll take her.
I remember the first day I shadowed. I would just, follow him into each and every room and, to give him help or if I needed to hold a pet or something. And all of a sudden I walk in there and I'm like, not, kind of just getting into this, kind of thinking, okay, what's going on? And then I realized when he was, because we had done a couple vaccines before, so of course he was putting stuff in the syringe and I'm like, okay. And then I'm like,
you didn't know?
I was like, oh, this is what we're doing.
Oh, good.
But yeah.
I'm surprised I didn't tell you.
Well, I had like stepped in there, not like right as that was happening, but right before.
Gotcha.
And I mean, there was kind of a weird energy, so I'm kind of like, okay, this is weird. And then kind of realized,
You didn't.
oh shit.
That would have been hard. I was like,
And then-
okay, I'm leaving
And then like the
room now.
technician was like mad that like he didn't have me like leave, and I'm just like, that was literally part of our requirements, or not
Right, yeah,
requirements, but that list.
Yeah.
So, but yeah, she goes, well, you should not have seen it on your first day, and I'm just like,
Well, your first day maybe, but still,
I'm
it
just
was
like,
on your list.
gonna have to see it eventually. Can't deny it that it's
Might
gonna
as well get it
happen.
over with.
Yeah. Yep. And now, anytime we see it on the schedule, I'm just like, oh, got euthanasia today. That sucks.
Right.
Well, then it's like sucks because it's like I feel like some people think you can just sit there and dwell on it, but it's like no. You may have had that euthanasia, but it's like you gotta dry your tears and go in and go say hi to a brand new puppy,
Right.
which sucks. But yeah.
Okay, so.
Felix can show up my blog.
It's kind
Have you ever watched one?
I've been in one.
Oh, okay.
I definitely just know how they go. It's just I hate it. Eyeball every time. After the one I've been in for my own dog, I just
See, that's what I'm like so thankful for is that I've seen many euthanasia, but literally after every euthanasia, I go and like sit and cry.
I've seen the ones that she has on the chapters that she probably won't show us, but the thing I don't like is they keep talking. It's like, for like 5 minutes before they do anything.
Yeah. But yeah.
yeah, I had to we had to put down my dog. His name was COVID, and he had cancer, and it just kept spreading.
Like it sucks. So it's like I can't imagine actually like euthanizing a pet.
Yeah,
but
like
it's
I couldn't imagine doing it either. I didn't realize that was like part of everything. Like I knew it was going to be. I just didn't think it was going to be
Yeah.
that much.
Well, there's been weeks. I mean, there's been weeks where we've done 2 a day every single day, and there's been weeks where there's been a couple weeks where we don't have one, and then there's a week where we'll have like 3 throughout the week. So
Yeah,
I can't imagine the shelter scenario of just continuous.
just continuing doing
And
it.
that's
Yeah,
why
I
he's
just- I
so
just don't
big.
think I could do it.
That's why he's so big on spay and neuter, is because he used to run the pound way back in the day. And when there's like 20 kittens or there's like 20 puppies. And he's literally told me there's been days where he's had to just euthanize 12 puppies. It's like, how do you do that one right after another?
Yeah,
That's the only part that gets me choked up about it.
yeah, I give a lot of people props for the used pets at the shelter and stuff. It's just I couldn't do it. There's no way I could do
Even
that many
if you like
animals in one
switch
day.
off, yeah. it's
Yeah,
just-
even with switching off, I couldn't. I would not be okay mentally. I just would not be okay.
Right.
That's a lot to do in just a day.
I love right? I was reading it and I was like, okay, super helpful, right?
I was gonna say, would you? Oh my god, that's perfect.
Just some tips to trick your body. Tips and tricks. Tips and tricks.
What time did she say we got? She said earlier today? What time it is?
Oh, she's
What are you guys talking about?
Okay, so
Well, I figured that's what it was, but I'm
she had a pissed off snake in a duffel bag and it was striking at her, so she was like, I had to channel my inner Steve Irwin and do that set me off. I had to.
sorry. Look at those teeth. He's going by. Watch you.
I do all these things, it doesn't help.
You like got it out. She's chill. Fine. So bad because like all of my family, my brother, he's definitely like they're coming soon. Yeah. Look what she posted on.
Speaking of snakes, my son has been saying that there's a snake in his room, and his grandma is so dramatic. She's like, "What? There's a snake in your room? Keisha, did you check?" And I'm like, "Yeah, my dad was over and he checked in there." Cooper was saying, "Oh, there's a noise in my room. And there's a snake in there." And I'm
Oh
like,
my god.
I think he's just like getting an imagination. Like, I was like, "There's not a snake in our house."
Doesn't help if there's a
Oh my
reaction.
god! Did you look? Did you look? Keisha, I'm like, "There's not a snake in the house." Yeah, I'll check.
No, I just left the snake in there with my son.
in my house.
He can fend for himself.
Huh?
There's a snake living in our crawl space or something.
My grandpa has a basement.
Yeah.
I mean, that's in his basement. They're fucking bombs.
The funniest. I try not to laugh, but my boyfriend, he was working on, because like half of the house is weird, his house. Half of it gets heat and half of it doesn't. So he was like trying to fix it. And he had to call into the house. I said, well, if there's any snakes, just don't mess with them because I know how he is set up.
Listen. You was gonna get my own little
like under
stash
the crawl
ready.
space.
It was just chilling like on top of the thing, and I realized there was already filled. I was like, "So I'm taking this, just in case."
This is my house.
She's every time I talk about it. Wait, what did you say happened?
Sorry, I was laughing too much.
Yeah.
So he had to work under the house, and I don't like snakes either. And he's not really like afraid of snakes. And I said, well, there's a snake, like, don't mess with it, like. And so he crawls under there, and all of a sudden it gets quiet, and I'm like, you okay? Because you can hear him through the air vents. I said, you okay? His scream when he actually saw one move. Funniest thing ever. Because it like scared me, but then it also like when I realized what just happened, started laughing. And, yeah. I got the silent treatment for the rest of the day because I was still laughing by the time he came out of
Sorry. Let's just get this shit over with.
I know. I'm like, I can't even hold together just to ask a fucking question about it.
So you know how you were talking about that person that someone took out? I saw it and I was like, oh, I might watch it. And then you started talking about it. I was looking at it.
Well, it's just the point of it. They pushed him so hard over. I mean, I get it. It's wrong, but it's like all it was to. And they're pushing him, like do all this stuff, and so they're pushing him to move on to other things and do it again.
Yeah.
So if they would have left it alone,
Do
they
it.
would have ended it that.
Mm-hmm.
But they put so much emphasis on it. But he's like, oh, now I have their attention, I have to do it again. Where it was just too much. The
What happened?
documentary on Facebook or on Netflix.
Like, don't put the cats.
He like
The guy that videotapes himself.
yeah, he put cats in the back and feel bad and killed them. And granted, I agree that's wrong. But the emphasis they put on it and how much attention they put on him, like gave him that attention he was looking for. So he did it again, and they put more emphasis on finding him. So it became a game. So they're like, oh, now I'm gonna kill another animal, and then he moved on to killing people because it was like a cat and mouse game. They were like trying to find him, and he's like, oh, they can't find me. And he put so much energy into it that they pushed him to
Yeah,
do it
people
again.
are messed
But
up,
it's like if they
dude.
would have left it alone and been like, whatever, he killed some cats and not put any energy into it, he would have done it again. That would have been the end of it. And it's like,
But there's like tons of videos.
and I'm like, I'm all for not,
Why do they
I'm all for when it's wrong, but it's like, leave it alone. Like, don't shoot it. Like, there are his cats, yeah, it's not a good thing, but the reason he put it online is because he wants you to, come after him, and it's stupid. And they put way too much time and energy into
2
it.
years.
Yeah,
I'll play it.
yeah.
My favorite is
When he drowned the cat, and you saw like the glimpse of the cat tied to the broom.
Oh, I
My
know.
cat looked exactly like that, and I was like, freaking watch this.
Yeah, I
I'm
know.
done.
It was hard to watch, but I think it's also stupid that they, it would have gone nowhere if they would have done anything about it.
What is that noise?
We're listening to professional whistling, sorry.
Oh,
Professional whistling?
didn't know there was such thing.
Oh, that explains it.
I can't whistle.
I'm
either.
just kidding.
My favorite thing to whistle to is the Andy Griffith theme song.
I
Yeah.
can whistle if I suck in, but not blow out.
I hate the sound. Really? It annoys the shit out of me.
Movies, anytime
It is
somebody's
creepy.
whistling,
Yes. Especially
That's
when like
why I
a
thought
man
about
whistles
those.
at somebody, like to get their attention.
When I
That makes
first moved
me
here, I
literally
thought about the
rage.
cicada bugs.
Yeah.
I was like, if you're a banjo, you're screwed. Those bugs that are super loud. Yeah, every time I heard that, I'm like, if you're a banjo, you're about to die. So I feel like they go hand in hand. So I'd never heard that in real life, except for movies.
Oh, the cicadas.
Cicadas?
Yeah. So like that and a
What else
banjo.
is it?
and
So
these bad
what else
news.
is the word for them?
Locust.
Locusts for cicadas.
Yeah,
You're right. Have you found its shell before?
Yeah. it's gross.
My mom likes.
hanging on a tree.
So my mom works at McConnell and does the Child Development Center. And when she was doing the preschool wing, she would literally take them out of the backyard and show them. Like take the kids.
Oh yeah, the kids like them.
Yeah, and there's like, and then of course there's some that are like scared of them. And she goes, oh my gosh, I got it. And there's like sometimes she'd take like 50 in there. I'm like, mother, you're freaking weird.
Kids love that stuff though.
I had to do that, and like it was like 60 bucks.
Ew.
It was pretty interesting. Sorry. Oh, you're getting weird.
What
I took zoology in high school, and we literally had to go back behind the school and catch bugs and kill them and put them on the display board. It was the nastiest thing.
Wait, what are we talking about? Can you hum and whistle at the same time?
How do you do that?
Is it possible? Yeah.
Seems wrong.
I have to breathe in the.
How do you like?
You can breathe in and out. I know I have to breathe in, but can I hum while I breathe in?
I don't know if I breathe in or out when I do it. I just whistle.
I'm pretty sure you have to breathe.
No, like in or out. Like I don't think it's.
I don't know which one that I do. No, I couldn't do it on command. I'm not
Just
dumb.
whistle?
No, because I get nervous and then I start laughing. You can't laugh when you, or you can't whistle when you laugh.
Okay, we're annoying Haley. She hates.
I'm about
She
to
hates.
smash my one.
She hates whistling. She said she hates the sound of whistling.
Oh, sorry.
It's fine.
Oh, no. I'm pretty sure, Gabby, your name is just officially Mrs. Smith now, by the way.
Oh yeah.
It's been.
I love how Amanda's voice.
Is this one out or in?
Yeah.
It's
Go that
like
way.
Yeah.
That's
So
out, I
decided that
think.
Gabby's name is officially Mrs. Smith.
because you're always like.
Every time you say Miss
Welcome,
Smith, you
Mrs.
watch.
Sue.
Thank you.
Thank you.
Those are my spares from graduation.
What'd you have on graduation?
People cry at graduation.
People
My mom called.
I can't even
Have you ever cried
do the
before?
traditional banner without bawling.
Are you gonna miss us when you graduate?
Of course, I miss all my students when they graduate.
Like my mom bawled.
I get excited
heavily.
when you graduate because then I can Facebook stalk you. And then, we're colleagues.
Yes.
So,
Besties.
besties. I do really enjoy when you guys graduate and then being able to follow up with you and kind of, see what are you doing in your clinic.
I legit thought she was gonna joke with us and say